Hello friends, I am Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In my last video, I had discussed what Ayurvedic treatment means, which is a combination of herbal oral medication combined with Panchakarma therapies and diet restrictions. Now here we will discuss what Ayurvedic Panchakarma means. Panchakarma means 5 procedures. So there are 5 different treatment modalities included in these Panchakarma procedures, which are usually done when nothing else works, when simple oral medication doesn't work, and we believe that a lot of doshas are accumulated in the body and these need purification. So these are basically purification procedures which purify different types of doshas or cleanse the body with these procedures so that the excess doshas can be removed from the body. So let us discuss what these 5 panchakarmas are. The first one is Vaman, which means induced vomiting. This is basically used for those patients who have excess of cough dosha and usually suffer from recurrent asthma, allergic rhinitis, running nose, or allergic skin issues, also eczema, psoriasis. So Vaman is very useful for these sort of diseases. The next one is Virechan. Virechan is nothing but induced purgation or causing loose motions with medication. This is basically used for pitta disorders, where a person complains of frequent acidity on and off, burning sensation in the body, frequent boils on the body, and lot of inflammation in the body. So Virechan is very useful for such patients. The third one is Nasya. Nasya is nothing but medicated nasal drops. This is basically useful for chronic running nose, allergies, or all diseases of the head. In Ayurveda we say Nasa hi shirasodvaram, which means the nose is the gateway to the head. So all medical issues of the head, for example chronic headache, migraine, such sort of diseases can be cured with the help of Nasya treatment therapy. Also, there are different types of Nasya. For example, some strong, very potent Nasya which is called Tivra Virechak Nasya. This can be used for patients of coma to help early recovery. This is the third Ayurvedic Panchakarma. The fourth one is Raktamokshan or bloodletting. In this, blood is removed either using leeches or with the help of needles and syringes. This is basically used when nothing else works or where the person complains of burning, pain in the body, or not recovering even with other panchakarma modalities, or there are a lot of boils on the body and pitta treatment Virechan has already been used but still not working. This also can be used for certain specific serious disorders. For example, we talk of gangrene. In gangrene, a part of the body, say the limbs, upper limb, lower limb, or the fingers or toes, can start getting going into death. The tissue destruction starts, and the only treatment in such cases is amputation. Here, leech therapy can help, and the amputation can be prevented, and after that giving oral medication can help the decaying or the tissue destruction to stop and recover. This is the fourth Ayurvedic Panchakarma. The last one is Basti. Basti is nothing but medicated enema. Now enema is the typical thing. What the problems which we face is that most people are not willing to go in for this sort of treatment, probably because of embarrassment, mostly in our country. But this enema treatment, Basti treatment, is very useful for a lot of disorders. Of course, it is useful for chronic constipation, but it is the seat, the pelvic area is the seat of Vata dosha, and this cures all chronic Vata disorders. Also, there are different types of Basti which we use for different diseases. So as I said, Vata disorders include all neurological disorders, neurodegenerative disorders. In addition, there is a type of Basti known as Tiktak Shir Basti, which we use in osteoarthritis, in chronic rheumatoid arthritis, and the results are very good. In addition, this sort of Basti is used for autoimmune disorders in order to treat the inflammation so that the recurrence of the disease can be prevented. So autoimmune disorders can be treated with a combination of Basti and oral medication, wherein the patient goes into complete remission and there is no relapse in future also. So this, friends, is a combination therapy which works very well, and this is a basic introduction to Ayurvedic Panchkarma. See you again.